Scenario D, PBL, by Shelley and Morgan, University of Ontario Institute of Technology, Dr. Amy Mamelow, March 29, 2015. Goals. Briefly describe the current continuing education requirements for registered dental hygienists in Ontario. Identify and discuss types of learning available and related learning philosophies which dominate continuing education in this profession. Discuss potential problems adult learners may face with this type of learning and the potential impact to public health and safety, and suggest possible solutions to these challenges. Currently, in Ontario, dental hygiene is included in the Regulated Health Professions Act and is governed by the College of Dental Hygienists of Ontario. The college is responsible for protecting the public by ensuring its registrants, the registered dental hygienists, maintain current and relevant standards of care which do not place clients at risk for adverse health effects. Registered dental hygienists in Ontario must complete 75 hours of continuing education over a 3-year time span. Many registered dental hygienists will aim for 25 hours of continuing education per year, but the distribution can be modified in order to accommodate major life events which may affect an individual's ability to satisfy the requirements, such as the birth of a baby or a life-threatening illness. Registered dental hygienists are required yearly to identify their own goals based on self-identification of learning deficits. These goals are then used to seek out learning opportunities which will satisfy these goals. Following completion of the learning goals, registered dental hygienists must complete a yearly professional portfolio which describes in detail the goal, the method or methods in which the learning was achieved, and the knowledge gained. This portfolio can then be selected randomly for peer appraisal. The CDHO allows a variety of learning styles for its registrants as long as it assists in the identified goals outcome and is relevant to the individual's career in dental hygiene. For example, I am currently completing a Pathways degree in Allied Health Science as a formal activity to obtain a degree related to my dental hygiene practice in public health, with the future goal of a master's degree in public health. Even though my courses are not dental specific, they are permitted as they relate to my public health practice. Because the CDHO allows dental hygienists to take the lead in identifying their own goals and complete their own learning geared to their own specific circumstances, it can be safely assumed that the CDHO has opted for a humanist adult education approach for the continuing education requirements. The CDHO encourages registrants to self-assess on an ongoing basis and modify goals based on needs. This allows registrants an opportunity to complete their learning goals with autonomy and thus achieve self-actualization through holistic, self-directed learning activities which are intrinsically motivated by their own learning needs. But is it intrinsically motivated learning? Can mandatory learning requirements and intrinsic motivation coexist? Although to most, having your own choice in learning goals and activities sounds ideal, there are potential issues with this approach, first being intrinsic motivation. According to Knoll's assumptions of andragogy, adult learners go through stages when considering adult education. First, what is the need for knowledge? Second, the idea of self-concept. In the case of the CDHO, this would be goal identification. Third, the importance of one's own experience, and fourth, a readiness to learn. It is the fourth step in which the problem lies. It cannot be assumed that registered dental hygienists will have a ready and willingness to learn, and to what extent meaningful learning can occur is debatable. The other issue with a humanist adult education approach is the potential lack of focus on foundational or core knowledge. Science is always changing. Areas such as pharmacology, medical conditions, and microbiology change frequently and have potential to cause harm to a client, yet there is no core programming which is required to be reviewed or updated in regular intervals. This can have a detrimental effect on an individual and should not be relied upon upon self-identification of learning goals to obtain, as it may come too late. Possible solutions to the problems identified in a humanist approach to adult learning include the individual's creation of long-term recurrent goals surrounding critical areas in healthcare, the creation of core requirements from regulatory body, and encouraging a readiness to learn or intrinsic motivation. One solution to maintaining current evidence-informed knowledge in the dental industry is currently what the CDHO encourages, which is self-identification of knowledge deficits and goal setting. In my own professional practice, I work in a low-risk office setting, meaning I do not regularly deal with complex medical histories. However, every now and then I am faced with an unknown medical condition in which I have to evaluate if the client is medically stable for treatment. Because of this, I have made a long-standing recurrent goals to review or update my knowledge in the areas of pharmacology, medical conditions, infection control, oral lesions, and medical emergencies every 3 years, as these items tend to change frequently. I have also made it my goal to review basic periodontics every 5 years. This is my personal preference. However, I feel that for critical aspects to this profession, I feel a more liberal adult education approach in which these topics would ensure safer current practice in the industry as opposed to relying on an individual to self-identify these deficits. The Royal College of Dental Surgeons of Ontario, the regulatory body for Ontario dentists, employ a points method of continuing education in which dentists are allowed to choose their own goals and learning activities to gain points based on the number of hours attended. With this program, however, they are mandated to obtain a certain number of points in their core areas. My solution to improve client safety involves instituting a similar process by which registered dental hygienists also have key core groups in which they must obtain formal education methods to achieve competency. This can be achieved through accredited online programs or classrooms with some form of evaluation at the end to ensure knowledge is understood. Some may consider this backwards thinking, but in terms of maintaining client safety and ethical practice, I do feel it is necessary to be stringent in this respect. It ensures registrants understands the authority of the CDHO as a regulatory body and prevents potential incompetency which could occur with a humanist approach to learning. This brings us back to the concept of motivation and requirements and how the two can coexist. Encouraging a readiness to learn can be difficult. According to Knowles, the adult learner benefits from intrinsic motivation versus external motivation. For many registered dental hygienists, motivation comes extrinsically from the fear of losing registration status, despite the CDHO's best efforts to maintain a humanist approach to learning. For regulated health professionals, there is clearly an external motivation that affects one's decision to pursue adult education. The ability to make choices in the learning goals and activities has the potential to lessen the burden of this type of mandatory education, but essentially, mandatory education is extrinsic in nature, and thus for the humanistic approach is contradictory in theory. Realistically, due to the nature of regulated health professionals, it is difficult to truly participate in a fully humanist approach if learning is not intrinsically motivated. McGuire, Cross, and O'Donnell identified this issue in 2005 in an article in the Journal of Human Resource Development Quarterly. They say, the humanist approach may mislead employees and perhaps HRD professionals by fostering the illusion that the needs of employees and organizations are always mutually inclusive. They go on to state, dominance of the humanistic approaches and the image that they present a softer, more responsive form of management contribute to the popular misconception that these approaches, by their nature, necessarily entail a relinquishing of managerial control. In reality, humanist approaches are indicative of a modern, sophisticated, latently strategic approach to people management designed to elicit proactive, self-motivated employee behavior. This supports the idea that true humanist approach to professional development cannot be attained and may in fact be a strategic approach approach to managing lifelong learning within a profession. Regulated health professional adult learning activities should be both humanist and liberal in approach to maintain client and patient safety and maintain a sense of autonomy within the individual. This can be accomplished through utilization of a variety of learning approaches to meet the needs of the learning outcomes. We must realize, though, that intrinsic motivation can be difficult, if not impossible, to achieve when learning activities are dictated or required, and many, if not all, learning within the scope of an individual's profession is externally motivated, which makes a true humanist approach to adult education within a regulated health profession is virtually impossible.